Hello, and thank you for joining us today. I'm Cynthia Dallara, Lakeview Personal Care Administrator.
I'm Janice Williams, Meadows Health Care Center Administrator. We wanted to provide you with a brief update about the care of your loved one in Lakeview and Meadows. We consider it a privilege to care for them at this time. Our teams are working around the clock to provide the best care and support to your family member.
Please be assured that we do not have a confirmed case of COVID-19 on our campus. We have put numerous processes in place since March 4th when our disaster awareness team first met to discuss COVID-19.
We have completed the following preventative measures to prevent the introduction and spread of COVID-19. We canceled all visitors to campus, including visits between different levels of care. We canceled group activity programs. While residents are not required to remain in their room at all times, group gatherings are discouraged, and we are actively reminding residents to practice social distancing. We canceled communal dining. Meal service is being provided in resident rooms, except for situations where a resident requires supervision with their meals. In that case, meals are provided with just one resident per table. In Meadows, when a new admission arrives or a current resident returns from the hospital, they are being admitted to one certain wing of the healthcare center or remain in their home for 14 days. This is so we can carefully watch for any symptoms of COVID-19. All protective equipment is used by team members during this time as per Centers for Medicare and Medicaid Services and Department of Health requirements.
When a resident is admitted or readmitted to Lakeview Personal Care, the resident is required to remain isolated in their room for 14 days. Again, appropriate protective equipment is used by team members during this time as per CMS and Department of Human Services direction.
For residents already residing in Meadows or Lakeview, team members are actively screening for fever and respiratory symptoms such as cough or sore throats. And new last week, residents started wearing homemade, donated cloth masks when out of room and during personal care that are laundered by team members.
We have also been busy putting in place preventative measures to care for our team members. These include screening all team members for fevers and respiratory symptoms at the beginning and end of their shift. We have reviewed with team members the proper way to use the personal protective equipment. All team members are now provided with a surgical mask to be worn at all times except while eating. And new last week was the addition of eye protection, such as shields. When team members are in close contact with residents, such as when providing personal care, eye shields are being worn. Wherever possible, team members are given consistent work assignments so that they are caring for the same residents as much as possible every time that they work. Lastly, we have stopped all crossover of caregiver staff. So a person who is screening individuals at the checkpoint would not also be going to the resident rooms to deliver trays. Staff who work in residential living would not have contact with a long-term care resident.
Again, I want to stress to everyone, we do not have a confirmed case of COVID-19 on our campus. We do have plans, however, and are prepared to act quickly if we would have a COVID positive case. We would maintain isolation precautions for the resident. We have a COVID area designated and ready if needed. We would notify a physician of any other orders. We would notify family of the resident, team members, and other resident families. For an initial case, we will contact all resident responsible parties via phone. Subsequent cases would be part of our ongoing communication, such as Facebook, information hotline, and the website. As always, if anything changes with your loved one's health, we will provide you with updates directly. We would also notify the health department and federal agencies as required. If we have a positive case of a tested team member, the team member would stay out of work per CDC guidelines. Our medical director, state agencies, and federal agencies would all be notified. For an initial case, responsible parties would be notified via phone. Subsequent notifications of new cases would be part of our ongoing communication, such as Facebook, information hotline, and website.
Additional cleaning precautions have been put in place, including cleaning of frequently touched areas of the kitchen, resident, and nursing areas. And a word on PPE. We have been closely monitoring our supply of gloves, masks, gowns, and eye shields, and obtaining additional supplies from our purveyor as we are able. Currently, we feel we have enough supplies, but we are using contingency strategies to maximize the use of our current supply. Our local and regional healthcare coalitions are also updated regularly on our supplies of PPE. If we would face a shortage, our healthcare coalition would assist us with obtaining what is needed.
So what can you do to help your loved one? We're still delivering mail, so write a letter. Your loved one would love to hear from you. Call your loved one. Hearing your voice will certainly make their day. Have a video chat. You can contact social services to schedule a time. We have a variety of platforms available to you. We are still accepting donations of masks, both surgical masks and cloth masks. Donations can be mailed or delivered. You can drop off a resident care package at our infection prevention trailer, which is located at our main entrance. Stay informed by visiting our website at www.telhi.org/COVID-19 or call our information hotline at 484-796-4862. You can follow us on Facebook at Hill of Life and pray for all involved, our residents, their families, our team members, and their families.
Thank you for taking the time to listen in today to our updates. Questions about these updates or any other concerns related to caring for your loved one at Telhi can be forwarded to myself or Janice by calling 610-273-9333. Thank you, and God bless.